Hi, welcome to another episode of Talking with Docs. I am Dr. Paul Zalzal.
And I'm Dr. Brad Wiening. On today's episode, we're going to talk about the sprained knee, or the MCL injury, typically.
Right, so this is a very common injury. We'll just tell you quickly what the MCL is so you know what we're talking about. Here's a model of a knee. This is the femur, this is the tibia. This is the medial collateral ligament, or the MCL. It lives outside the knee, so it's extra articular. It's not in the knee, but it is commonly injured.
Okay. How do you normally injure this, Paul?
Well, when I want to injure my MCL, I would forget how to ski, put on some jeans, and hit the slopes.
I like it, and I've seen those people, the learners, the geners, on a snowboard who are not
genes directly correlated with the MCL
I think
injury?
it is a higher risk, not of that person getting an MCL, of you getting an MCL. Being near a gener poses a risk to your MCL. Right. And when someone hits you from the side, so causing that valgus stress like you're talking about, so hitting you from the outside, stretching the inside. And when it stretches, those fibers tear, and they either can tear partially or completely. And this causes pain, causes you to fall to the ground, and now you've missed the après ski, which arguably is the best part of the ski day.
That's right. Hot tub is not going to happen for you.
Okay, so what are your symptoms?
Well, the first symptom is pain.
Yeah, pretty severe.
And then some swelling, maybe even some bruising, and a limp, or even an inability to weight bear and difficulty bending your knee.
Okay, so you are at that proud moment where you're put on that little lifter on the slope, and the people are lifting you off, and you're going down, and people are looking, pointing, taking pictures. You end up either in a family doctor's office, a walk-in clinic, or the emergency room. What happens there? Okay,
so you're going to get assessed by the emergency room physician or the physician on duty, and they're going to take a history, and you're going to tell them I was wearing my jeans, skiing down the hill, and they're going to say, that's your first mistake.
There you go. They might cut your jeans off, actually.
That can happen, so you better not wear the $200 designer ones if you are going to ski in them. So you're going to get assessed, the history of some sort of trauma. The symptoms that you're having are going to be recorded. Physical examination is going to show tenderness over the origin, so where the MCL is coming from, tenderness over that area. The knee itself may not have fluid in it or an effusion, because this is an extra articular or an outside the joint structure, but it will be sore, and there may be some swelling over here.
And then the other thing that if the doctor tries to stress that ligament, putting what's called a valgus stress on it, the joint may actually open, and you'll actually physically be able to see it and feel it, and the patient will reproduce their pain. Mm-hmm. Okay, so you've determined that clinically that you feel like they have an MCL injury. Any investigations that they're going to do?
Well, we always like to get an X-ray.
Yes.
In orthopedics, always to rule out other things. You could have a fracture. Yep. You could have things that don't even show up on X-ray, but an ACL injury, a meniscal injury. So we want to rule out all those other things, but the X-ray helps rule out a fracture, a tibial plateau fracture that can sometimes occur in the same setting.
Absolutely. Patients always, when they come to see me at a week or two, and I say, hey, you have an MCL injury, here's our plan, they're like, well, don't you need an MRI?
No. Bottom line, it's a clinical diagnosis. An MRI can help you determine the severity, or down the road if things aren't getting better, or to rule out some of those other injuries, ACL or meniscus.
Commonly happen when skiing as well.
Yeah, but if those can be ruled out on a clinical examination, then you don't need the MRI for the MCL injury itself. But to rule out other injuries, it might be necessary. Okay,
so you've made the diagnosis, you're confident, treatment. Usually I'm putting these people in a hinge brace. Do you?
Yeah, so it depends on the grade, right? Like we do with all our injuries, we grade them in grade 1, 2, 3, depending on how much opening there is, if there's any opening of the joint.
Yep.
So in a grade 1 where there's no real opening of the joint, it's just tender on the inside, and you trust the patient enough not to engage in any high-risk activities, then you can treat that without a brace, I think.
Yep.
But anything you're worried about, there might be some laxity in that ligament, I would certainly brace it.
Fair enough. How long?
The brace, by the way, doesn't hold the knee out straight. The brace stops the varus valgus load, but still allows the knee to bend.
Right, because you don't want it to get stiff.
Yeah, exactly. So you're looking at about, 6 weeks.
Yeah, I'd agree with that, and then I transition them into physiotherapy, and maybe even earlier on, get them into physio, working on quadricep strengthening and maintaining their range of motion for stability.
And don't ski in jeans anymore.
Don't ski in jeans anymore. If for whatever reason they have a prolonged course, then you might do further investigations. Some people still will tell me at 6 weeks, hey, do you need to scope my knee for my MCL?
Yeah, the MCL injury does not need to be scoped.
No.
Remember, this is a structure that lives outside the knee.
Yeah. So you get them back to their normal stuff. I typically tell them it can nag on for 3 to 6 months. Let pain be their guide as far as returning to sport. And then they may or may not need ongoing brace support. But typically if it heals, I think their ligament is going to be what provides their support. But sometimes it's a mental or a confidence thing, and some people like to wear braces for some activities.
All right, that pretty well sums up the MCL, sprain of the knee. We talked about the mechanism. We've talked about making sure it's not another injury there going on. Gone over some of the treatment.
Very rarely, I guess, you'd need surgery. Those are extreme cases,
Very
and certainly
rare.
your treating physician would talk about that. So that kind of sums it up. If you have any further questions, please feel free to email us at info@talkingwithdocs.com.
And remember, you are in charge of your own health.
And if you like this video, please like it on YouTube, subscribe to our channel, and we'll see you next time.
Thank you.